Thrilled to be joined. In fact, not only thrilled, I'm actually fascinated, David Agus, to be joined by you because, well, let me just start by saying you are the co-founder of Navigenics. You are many other things. You make a lot of health issues, especially cancer, and the treatment that comes with it, I think, accessible to people. And I'm one of those people because my mother was diagnosed 4 years ago. She's been battling cancer, and at the very beginning, I was dumbfounded and confused and perplexed with the treatment, the more I would learn about it. And, you know, so I wanted to mention that off the top because you're not only a leading cancer doctor, but also you focus heavily on research. And I know that you recently, we were just chit-chatting, came out with this book, A Short Guide to a Long Life. God, that was a long intro. But why that title and why that approach?
I wrote a book 2.5 years ago called The End of Illness. When I originally wrote it, I called it What is Health and a question mark? Because to me, that's a key question. I don't know what health is. Yeah. Is it how you look? Is it how you feel? And without a metric, how do you optimize? And I got a call about a week later from the publisher who said, Steve Jobs called and changed the title of your book. I'm like, he did what? And I called Steve. I go, what did you do? He goes, you can't put the word health in the title. It's a bad word in our country. It turns people off. You say health, their eyes glaze over. It's like chewing cardboard. Interesting. And so the first book was The End of Illness, bold and declaratory. I was shocked how well it did, and, you know, really around the world. And so the new book is just what you need to do. It's the to-dos and not to-dos, a short guide to a long life. So say what it is. And again, I kept the word health out of there so people don't get turned off.
You know, the reason I was so excited, to be very frank, to speak with you is in the book you actually have a couple acknowledgments that are quite notable, including Larry Ellison, Brad Gray, Steven Spielberg, Gayle King, Al Gore, Charlie Rose. I mean, the list goes on. And you, in the book and in everything that I think you do when you're explaining these things, how to live a long life, the do's and don'ts, as you suggested, are adamant about this one fact that I find really compelling. There's no data to support the notion that vitamins of any kind, you said once, either make us more energetic or live longer. Now, the reason I want to ask you about this is that I think we often self-diagnose and we think, okay, if we take vitamins, we're going to be healthy. Why is that not necessarily true?
But, you know, it's not my opinion, it's the fact. I mean, so in the history of mankind, there have been 65 randomized studies between vitamin and supplements and placebo, and none, zero, goose egg, have ever shown a benefit in a normal individual for preventing a disease, for living longer or better.
So is this just marketing? Are we?
Remember, all a vitamin is something the body can't synthesize enough of. Right. It doesn't mean more is better. But we're a quick fix society. Right. I want something, you know, listen, I had bad food last week, let me fix it by having a vitamin. And that's the mentality out there. Right. So, you know, Linus Pauling, you know, 30 years ago now, double Nobel laureate said, you know, vitamin C could change everything. And people started to listen. Everybody believes in something they want to help their health. Right. But the data just aren't there. And the counter data are there. Right. Remember, our country spends more on vitamins and supplements than in all of medical research. Men who take vitamin E have higher prostate cancer by 17%. Women, elderly, who take high-dose vitamin D, 26% increase in bone fracture rate. Not decrease, increase. Smokers and former smokers who take vitamin A and beta-carotene, dramatic increase in lung cancer and death. And by the way, death is a bad side effect.
And all these facts that you're coming up with are actually less funded than the vitamins themselves.
Right, but this is, the vitamin E study is a $250 million study to show that. Right. So why are we as taxpayers spending all that money to the government to do the study, yet we don't listen to its results?
You know, you're talking about us all wanting a quick fix, and it's funny because there are a lot of different intersecting kind of fields here and disciplines at Davos. And, you know, I've been interviewing several people who are talking about quick profits in the business sense, you know, in sustainability and how investors are more likely to want to invest when there's profits that are coming quick. And I don't know if I'm tying two things together that don't necessarily make sense, but what do you think this suggests about our mentality, the way we approach health care in the field, but also as Americans, as individuals? I mean, how we approach our own health.
You know, listen. Our healthcare system, the EU's healthcare system, Asia's healthcare system is all bent around disease, right? You go to a doctor when you get sick. Yeah. Doctors are incentivized to treat, do a surgery, do a procedure. We need to change the system to incentivize to prevention. Right. And so it's something that we just don't think about.
Is this a cultural problem? Because I've heard this discussed. I mean, it's part of the whole Affordable Care Act. You know, Obama talks about this.
First of all, it's not part of the Affordable Care Act at all, unfortunately.
Well, rhetorically it is.
They don't incentivize you to prevent. Yes, they make it so you don't have to pay for your flu shot.
Right.
That's not incentivizing you or the physician to give it. What do you say to the doc who didn't give his patients a flu shot? We say nothing to them. We should be hitting them in the head. Listen, a flu shot is a no-brainer in today's world.
Yeah.
It can't give you the flu. It cannot cause autism. It causes a pain in your arm, but that's about it.
Right.
But it dramatically lessens the flu. And we had 40,000 deaths a couple of years ago from the flu.
Yeah.
And if you skipped the flu shot as a 20 or 30-year-old,
yeah.
you got the flu, you'd survive. But a decade from now, your rate of heart disease and cancer are elevated. And then we as a society pay for your heart disease and cancer.
Do you sometimes feel like, I'm sorry, I'm fascinated by this, the reluctance or the lack of progress. I mean, I have heard people talk about the need for preventative approaches to a lot of the world's problems, but namely health. What is it that's preventing us? I mean, do we need a pause button? Do we?
But it's very hard. How do I say you, I don't know how old you are, 25, 35, if I'm a 30-year-old, how do I say, take this today, and it's going to prevent a disease 20 or 30 years down the road? You look at me and you'll roll your eyes. Right? Why would I intervene today? Why would I eat something a certain way today what's going to help me decades from now? By then we'll have a fix. That's how we all think, right? We're a society about today, not about tomorrow. And we have to change that mentality. So if I'm the NIH, I take a good fraction of my budget and I develop a marker for health. So without that marker, without that metric, we're not going to work on something today for tomorrow. And we don't have that. So we need to focus our research dollars to do things like that, and that's how we're going to change things. You know, devices like this that look at how much I move during the day, it works because I have a metric. I've got a number. Hey, what did I do today? And I start to compete. You know, at the end of the day, I'm below my wife. I walk the dog so I can go to bed number one. Why? Because movement matters in health. So all of a sudden we have a metric here.
Speaking of metrics,
yes.
Why do you do yoga? I know you do it almost every day.
I do yoga, and you know, no offense, and I'll probably get in trouble for saying this. I don't love it, but it works.
Yeah.
So it's been around for thousands of years. It's positions where I don't hurt anything or break anything, and it works.
It works meaning what?
Stretching and core are key to long-term quality life. You know, if your back's starting to hurt you when you're 30 or 40, it's only going to get worse as you go to 90. And so you need to work to build those core muscles, to work on stretching so that we can go to our 9th or 10th decade. We weren't engineered to live until our 90s or 100. We got to change a little to be able to do that.
You know, the reason I ask you that is because every time I go see a doctor, and I like seeing some doctors, I don't like seeing other doctors, and there's usually a very fine distinction, and the line is when a doctor treats me as though I am a clinical, you know, physical-only being without any sort of mind, because I'm a very psychosomatic person. Now I'm just, this turned into Oprah, but in all seriousness, I read a book by Dr. John Sarno from NYU called The Mind-Body Connection when I was 18, because I was having crippling back pain for months. And I was shocked, because at 18, using your logic, I thought, well, if my back hurts now, what's going to happen when I'm 30, let alone 50, let alone 8? So it changed my entire approach to my own personal approach to health. And I'm curious, yoga, stretching, health, how important is the mind when treating patients and when trying to create a system for health care?
Listen, it's the most important thing.
Is it? And
by far.
No one talks about that.
So the data across the border, people with a belief system, it doesn't matter what it is, and a positive outlook do 20% better in clinical trials than everybody else. So that's
Why is it missing then? It's missing. I mean, would you agree that it's missing?
Because we can't measure it. We're a society that unless we can't measure it, we don't talk about it. There's a problem there. I agree with you. So it's a mindset. It's knowing yourself. And I wrote the first book because I want to empower people to know yourself. The notion that you go to your doctor's office and he or she check your blood pressure at 2 o'clock and put you on a pill, that's crazy. You need to go in there with 3 months of data. With enough data, error goes away. I want people to get naked once a week and look at themselves in front of a mirror and look for changes, because that's how we're actually going to know things and know how things are changing your body. Your doctor sees you once every year or two. And so the notion, well, my doctor didn't tell me to do it, so I'm not doing it. Screw that. You go to your doctor and you say, listen, I have these 10 things. Let's talk about them. I want you in charge of your health care. So it's a team.
And why do you think so often prescriptions are the solution, or at least that's the perception when you do go to the doctor? At least in my experience, that's been the case. Especially, and I have to say, it is slightly different in the U.S. than in other parts of the world where I grew up. Oftentimes when I come with a problem, whether it's minor, acute, or chronic, almost more, I would say the majority of times, regardless of who the doctor is, they almost want me to take a medication, and I'm very apprehensive just because that's how I was raised. Is that a fundamental problem, or is it just the reality of the business
of medicine? When somebody tells you, they don't get paid from writing a prescription.
No, I know.
So,
I know.
I mean, I don't think that's part of, there's no incentive there, but it's a notion of value. If you go to your doctor and they tell you, well, I want you to stretch and do exercise,
you're gonna feel like,
you don't perceive real value. If they say, here's a prescription, you perceive value. And they feel, listen, I helped him or her because I wrote them something and told them to do something. Whether it be taking a vitamin, a supplement, a medication, it doesn't matter. There's that transfer of something that implies value, and I think we have to change that mindset. There's an art to doing nothing.
There is an art to doing nothing. I should end on that point, but I would be remiss not to act it. You gave it to me. But about Davos, I mean, such a unique, distinct event. There are skeptics who say that, you know, it's a lot of fat cats. I think actually Bono in 2006 said it's a whole bunch of fat cats who get together. I mean, what do you view as the benefit of Davos? I mean, for you personally, but also for society in the world.
Well, I mean, to me, it's two things. One is I am so, or was so, U.S.-centric in how I viewed the world. And the beauty of coming to Davos is I meet with health leaders in sub-Saharan Africa, in the EU, all over the world, and I learn so much, and we can interact, and they learn from me, and vice versa. I meet with the heads of the pharmaceutical industry, and I could push them and advocate for progress, for them taking risk, which is what it's all about. And so I can get this all done in a period of 4 or 5 days. And at the same time, I can talk to people from different domains and give my sessions here and educate them about health. So it's an absolute privilege. I thought, like everybody else before I came here, that's what it was.
Yeah.
And now I realize it's an absolute privilege to be here.
Right.
And so, you know, I'm honored to be here and honored to speak to people and push on these issues. I'm doing 4 sessions here and educating people on health. That's my role.
And you brought up metrics, and you talked about how important they are and how we need them, and without them we feel like, oh, well, what's the point, and, you know, kind of lost. At the Huffington Post, Ariana often talks about the third metric, if you will, this notion of redefining success, what it means to be successful as a company, as a society, as an individual. What is success to you? I mean, in your career, fine, but as a human, as a healthy human.
You know, my goal is to
make... Who does yoga and looks in the mirror every day, or every week, as you suggested?
My goal is, you know, is honestly to change the world in health. You know, I take care of patients with cancer and other advanced diseases. And my job isn't just to take care of them, it's to change how we take care of them. We have to admit from weakness that we're not great at what we're doing. I can't cure somebody of advanced cancer, and I know that. So it's my job to change that. And so whether it be educating, whether it be research in the laboratory, or presenting new ways of thinking, it's our job to push and to create discourse. You know, without discourse, there's no understanding. People come to me sometimes and go, isn't it horrible that President Bush outlawed federal funding on stem cells? I go, are you serious? It's one of the greatest things ever to happen to medical research.
Because we talked about it?
We talked about it, and everyone on the street in New York and LA knows what a stem cell is. It's brilliant. He was a brilliant facilitator of knowledge. And obviously, being somewhat facetious here.
Well, I got it.
But it worked.
Right.
And it's powerful. And so we need to bring that discourse out there. Health and food are 31% of the U.S. economy. It's about 26% of the world economy. And yet there's no discourse. All we talk about is healthcare finance. So it's a privilege to be here in Davos to shift the conversation from the healthcare finance side to the health side.
All right, such a great point to end on. Thank you so much, David.
Thank you.
Such a pleasure.